This is Brown's Emergency Ultrasound January Case of the Month by one of our residents, Kelly Wong. This is a case of a 20-year-old male who came into the emergency room. He was setting off some firecrackers at home and he had one of them on his lap and it went off accidentally. Came in with a chief complaint of an injury to his thigh area and to the groin region. We did an ultrasound of his testicle, and if you look here on the left, this is a schematic drawing of the testicle, and on the right-hand side is the correlating sonoanatomy. So this area is what is the body of a testicle as it appears on an ultrasound. And this image is captured with a linear probe with the probe marker pointing towards the patient's head, so a sagittal plane. You can see behind the testicle the epididymis, right, which corresponds to the epididymis over here on this drawing. Scan technique for the testicle is fairly simple and positioning is pretty important. I tend to drape a towel underneath the scrotum to lift it up from between the legs, and then use another towel to cover the penis and put the penis flat on the patient's belly, and try to keep them as comfortable as possible during the scan. I'll scan through both testicles and both planes, so starting with the unaffected testicle or the side that doesn't have any pain. In the sagittal plane, you'll scan all the way from left to right, and then in the transverse plane, you'll scan all the way from the top to the bottom. Next, depending on what you're using the ultrasound for, you may consider using power Doppler. So for example, if you're thinking about epididymitis or torsion, you may be using some power Doppler color as well. And this can be used to help assess for flow to the testicle and the epididymis. Generally, we'll set the power Doppler settings on the unaffected side first, and then evaluate and compare the affected side. Again, in terms of what normal testicular anatomy will look like on the ultrasound, this is a transverse view of both testicles, and you can start to see what the normal echogenicity of a testicle on ultrasound appears like. Finally, we've got on the left-hand side a normal appearing testicle as you fan through. The echogenicity is what we would expect. And on the right-hand side, this is the ultrasound of our patient's testicle. You can see a lot of mixed echogenicity, and you can also see some free fluid around the testicle. And this patient basically had a testicle rupture from the firecracker and ended up having to go to the operating room for repair.